Sounds like you're pretty active, especially with 13 grandkids.
Yes.
Can you
Yes.
tell me a little bit about the types of symptoms you were experiencing?
Mainly I was limping a lot. There was a lot of pain in my right knee, and it seemed to be swollen most of the time. And so I had to give up dancing, which my husband and I were doing ballroom dancing. I had to give that up. And even when my grandchildren were noticing that, they would pamper me because I was limping all the time, having difficulty doing any kind of work that required me to be up and moving around. So that's pretty much what I was experiencing. I went to the orthopedic doctors, and they told me that I was a good candidate for surgery, knee replacement. They said, come back in 4 to 6 months and we'll get you set up for it. But that wasn't the best option. I didn't really want to do that.
So tell me about the procedure itself, sort of how things were performed and how you were treated.
I was very, I had brought in some x-rays from when I had taken probably about 2 or 3 years ago. And I met with the doctor, and she took a look at what the damage was. And she said, I think that the stem cell would probably be your very best option. And the staff was incredible. I felt so relaxed. So we set up for me to come in for the injection of the stem cells. And of course I was very, very nervous about that, but I shouldn't have been. The lady who did the injection was, to me, a miracle worker. I honestly did not feel any pain. And I watched it on the scope, the injection, and I watched those little baby cells going in. And I thought, okay, here we go. So everybody was just wonderful to us.
What would you say your pain level was before the procedure on the scale from 1 to 10, 10 being the worst? And what would you say it is now?
A lot of days I was up there 7, 8. That's why I went into the orthopedic surgeon to see what their options were. Now we're back to dancing in the kitchen. We took a long walk. Dr. V here at the center told me to gradually work my way back into exercising. So I do the bicycle at the workout center, maybe for 20, 25 minutes. I don't do anything really strenuous if I don't have to. And I usually get in my mile of walking at the rec center also. And a couple of weeks ago, we took a mile walk, and I was just fine. I'm not limping, which is an hallelujah. It's just wonderful to have my life back. Really wonderful. I know what I experienced before, and I know where I am right now. And I'm gonna have a great retirement. Many, many years.